The West African Node of Excellence for TB, AIDS and Malaria, Wanetam, ran from 2009 to 2014, and Wanetam Plus from 2011 to 2014. Funded by the European Union, European Developing Countries Clinical Trials Partnership, Wanetam's mission was to build capacity at West African sites for clinical trials in HIV, TB and malaria. MRC Unit The Gambia, headed by Professor Umberto de Alessandro, is the focal point for TB, led by Dr. Martin Antonio, Senior Scientist and Unit Molecular Biologist, and Professor Tumani Kora.
I've been working with Wanetam since its inception. And in fact, my relationship with ADCTP goes well beyond that. Indeed, I was a member of the DCCC responsible for the creation of the Nodes of Excellence. Wanetam has achieved, despite all the difficulties, particularly in terms of the language barriers. Wanetam has 3 main languages: English, French, and Portuguese. And we've successfully managed to integrate our courses and our training programs to effectively develop that which Wanetam was supposed to.
As a group that is trying to build capacity and networking among researchers, I find the work extremely important for our sub-region, mainly because these researchers will be strengthened in terms of their skills and ability to conduct high-quality research that would answer some of the questions we have so far as key diseases like malaria, HIV and TB are concerned. As WHO, we are highly supportive of this important work in the sub-region.
And the idea of the workshop, and one output is that each country will take a lead in writing a manuscript on their country-specific data. The idea is that we're going to publish a supplement as on our output. We are still discussing the nitty-gritty about how to go about this, but obviously all the manuscript will need to be of top quality because it will be sent for peer review. So the essence of this workshop is really to look at the data that we've generated critically over the past 5 years. And I'd like to thank everybody. So thank you very much.
It's fantastic to see how Wanetam has come to fruition. Martin Antonio and I worked at the MRC together on the first Wanetam submission from the TB end in 2005. And we were colleagues in the same office, and neighbors, and we invited those people we knew who were working on TB in the region to join the Wanetam network. And then in 2011 we expanded by inviting more TB colleagues from the region to join in the Wanetam Plus additional project that expanded the Wanetam network. And it's wonderful to now see how all the partners from 9 different countries have really worked hard on showing that they can culture TB, isolate TB, test it, send it, ship it. Many have come here to do the trainings on their own strains, and together with Jacob O2, and now they're ready to analyze their own results and really see how that interpretation of the prior work done in their setting and what it means for public health.
TB kills an estimated 3 million people every year worldwide and is the biggest killer of HIV-infected people due to the overlapping incidents and interactions of these diseases.
The Wanetam has been a great success personally for the country, the Gambia, not just in terms of diagnostics, but also in terms of research capacity building. On behalf of the government of the Gambia and on behalf of the Ministry of Health and Social Welfare, I want to take this opportunity to thank Wanetam for this revelation in diagnosis of TB at a very, very short time. I think this will make a big improvement in our public health systems management of this very deadly infection in our country.
Multi-drug resistant tuberculosis caused by rifampicin and isoniazid resistant strains of Mycobacterium tuberculosis is an increasing global problem which requires permanent monitoring to efficiently control the spread of these bacteria.
I work specifically on drug solubility testing, both first line and second line drugs, and then do the genotypic aspect for speciation. Now, the unit won the Note of Excellence with the UDCP on Wanetam grant to run capacity building to prepare West African sites for clinical trials. On this note, we had 9 sites within the West African countries, namely the Gambia, Ghana, Guinea-Bissau, Nigeria with 2 sites, one in Ibadan, University College Hospital, and then one with NEMA, Nigerian National Institute of Medical Research. We have Burkina Faso, Mali, Senegal, and Togo, where we brought about all the participants 2 per groups for initial capacity building, from sphere microscopy up to culture and molecular diagnostic work for a period of 1 month.
Over a period of just 1 year in affiliation with Wanetam, the chest clinic laboratory, who used to be an ordinary smear microscopy laboratory, after evaluation from a German consultant, the laboratory was recommended to become the national reference laboratory for tuberculosis. So equipment were moved from the National Public Health Lab to the chest clinic lab for that purpose. So as we speak right now, the chest clinic laboratory is the Ghana National Reference Tuberculosis Laboratory, and all credits must go to Wanetam and ABCTP.
Participants were also equipped with the molecular and epidemiological tools to independently conduct drug-resistant surveillance. Furthermore, participants were instructed on data analysis and scientific presentation and writing skills.
We've been able to acquire a lot of capacity that was not there before. We had a lot of training and it had improved our performance in the lab. We've been able to gather a lot of data on multi-drug resistance for our site.
Since the beginning of the Wanetam Plus project, I think my institution has benefited a lot from the different training organized by different sites. We have been really lucky to participate to all those activities, workshop, training, and really it has been a good opportunity for me and my team to really get involved, and we learn a lot during those workshop training.
The training help us in our country to perform how we are doing every time. We have now to do an exam of all the patients we have. We have microscopy, we have culture, we have DST for TB.
I come from Burkina Faso in Centre Mires Research Institute. Donc, on behalf of Professor Nicolas Meda, I will thank all the staff of Wanetam, our network. Thanks for EDCTP for supporting our network, which is the Wanetam network.
I'm representing the Wanetam TB site, University of Ibadan. We have been in the program since 2009 up to date. And Wanetam has really helped a lot in terms of TB diagnosis in the African sub-region. It's a program that actually helped a lot in capacity building, infrastructure and equipment procuring.
I am in the bacteriological lab of Hôpital Aristide Le Dantec in Senegal. The chief of this hospital, this laboratory, is Professor Suleiman Bou. For my labs, we have got through Wanetam many equipment that make easier our research.
I am the research collaborator and Wanetam focal point for Guinea-Bissau. So specifically for my country, and we are benefit from this, from the Wanetam network, because it helps us to capacity building, helps our TB laboratory in terms of infrastructure upgrade.
The Medical Research Council Unit, the Gambia, hosted workshops in which scientists of the Wanetam member countries were taught in core microbacterial disciplines such as isolation of mycobacteria, bacterial cultures using solid and liquid media, and storage of isolates.
Participants from institutions all over West Africa came here to look at the data that collected during the project and just look at the data, results, interpret them, and then start to write up scientific papers. So it is very important because it's really the output of the activities that went on for the last 3-4 years. So hopefully this knowledge that has been generated is going to be public in scientific journal, also in other media, will help in fighting the diseases, in this case TB, but also, as I said, HIV and malaria.
We have developed clinical sites that are now ready for trials, and we are ready to go on to the next phase, that is actually writing and winning grants and carrying out major clinical trials in the sub-region. Our capacity development activities will continue. Stronger institutions will continue to foster not so strong institutions, and not so strong institutions, whilst benefiting from the experience of the stronger institutions, will provide the wherewithal for successful and large-scale multi-center studies. The future for Wanetam is bright.